So today we're going to go over joints. So just a basic definition. So joints link the bones of the skeletal system. They allow for movement and they're going to protect our softer organs. Think of like your rib cage. Those ribs are protecting your internal organs. Today we're going to classify joints by structure and function, and we will also go over some body movements. So first we can classify joints by function. So a synarthrotic joint is an immovable joint. These are your fibrous joints. An example of that would be a suture in your skull, the joint between your cranial bones here. Here we can see that sagittal suture here. That's an example of a synarthrotic joint. That's also a fibrous joint. We're going to talk about that in a little bit. Also an amphiarthrotic joint. This joint is going to allow for some motion. An example of these are going to be your cartilaginous joints. So an example of that would be like between your vertebrae, you have that joint is called the intervertebral joint. Also diarthrotic joints. These are freely movable joints. These are going to be your synovial joints. You can take a look right there. Now we can classify joints by structure. So you have fibrous joints. These are your synarthrotic joints consisting of bones joined by short connective tissues. Some examples of these, there are three of them. There are sutures. We already talked a little bit about that. Then you have a gomphosis. For example, the joint your tooth is held in. And then we have a syndesmosis. We're going to go over these individually, but I just want to kind of just list them here. And then we also have cartilaginous joints. These are amphiarthrotic joints consisting of bones united by cartilage rather than fibrous connective tissue. And examples of that are your symphysis and your synchondroses. Also, last we have synovial joints. These are your diarthrotic joints. These are the freely movable joints. They consist of two bones whose articular ends are covered with hyaline cartilage. The bones are separated by fluid-filled joint cavity, and that fluid we call that synovial fluid. So we're going to go over these examples as well. So there are plain synovial joints, there are condyloid, there are saddle, there are hinge, there are pivot, and then there are ball and socket. So now we're going to look specifically at fibrous joints. Here we already talked a little bit about sutures. These are going to be forming most of the connections in the skull here. And here we have a syndesmosis, so between the radius and the ulna. This is an interosseous membrane that's going to form that syndesmosis. And then over here we have a gomphosis. So this is a specialized fibrous joint that anchors a tooth to its socket in the jaw. So here we have our cartilaginous joints. So you can see here we have a synchondrosis. This is going to unite the shaft and the end of the long bone, and it allows the bone to grow in length. So right here in the growth plate right there. So that's a synchondrosis. Over here we have the pubic symphysis. So this is a symphysis, and this is going to unite the two pubic bones here. So that is a pubic symphysis. Synovial joints. So synovial joints allow for smooth movements between the adjacent bones. The joint is surrounded by an articular capsule that defines a joint's cavity filled with synovial fluid. The articulating surfaces of the bones are covered by a thin layer of articular cartilage, and ligaments support the joint by holding the bones together and resisting excess or abnormal joint motion. So here you can see we have the articular cartilage on the bone here, and you also have this joint cavity. This is going to be what is filled with synovial fluid to add more cushion to the joint. Also here we have the synovial membrane right here, and then on the very outside we have the articular capsule right there. So we have 6 categories of synovial joints related to their structure. So we have plane joints, we have hinge joints, we have pivot joints, we have condyloid joints, we have saddle joints, and we have ball and socket joints. And within the name, it gives you a hint to what their function and structure is. So plane joints, these are going to be flat articular surfaces that allow for gliding motion. So right here you can see an example would be an intercarpal joint between the bones of the wrist, the carpal bones, intercarpal in between. And then also let's look at a hinge joint. So this is going to allow motion in one plane here. You can take a look here. So here's a hinge joint down here, the elbow joint. It's going to allow that flexion and extension there. Pivot joint, so the end of one bone fits into a ring of a bone or a tissue of another bone, allowing rotation of the bone about its own axis. A great example of that would be the atlantal axial joint. Right here we have the proximal radial ulnar joint. That's a good example as well for a pivot joint, but really the great example is that atlantal axial. So atlantal meaning the atlas, axial meaning the axis, C2. So C1 and C2 is a great pivot joint with that dens poking up. Allows for that pivot motion. So whenever you shake your head no, that is the pivot move. You're really using that pivot joint, that atlantal axial joint. So that would be shaking your head no. Down to condyloid, an oval articular surface. It fits into an oval depression in another bone. So the example here we have the metacarpal phalangeal joint right here. You can see that. Then we also have saddle joints. So this is a joint where the articular surfaces fit together and it looks really just like a saddle. So for here we have that the carpal metacarpal joint for the right there. You can see that for the thumb. Also we have the ball and socket joint. So the round head of the one bone fits into the socket of another. So here the glenohumeral joint, also called the shoulder joint in layman's terms. But yeah, so that's your GH joint, your glenohumeral joint. So very much so looks just like the example. There's a ball going into the socket there, which allows for a lot of motion, which makes sense by looking at the structure. So now let's talk about the classes of synovial joints by planes of movement. So first we have non-axial joints, so no movement around an axis. The bone glides past each other. The bones will glide past each other. An example of this would be the vertebral costal joints, so between the vertebrae, thoracic vertebrae, and the ribs. So that is an example of a non-axial joint. Now we have uniaxial, also known as monoaxial joints. So these are going to allow motion in one plane or direction around a single axis. So an example of this would be your elbow joint, your humeral ulnar joint. It's going to allow for flexion and extension. Then we have biaxial joints. These are going to allow motion in two planes around two different axes. The example of this would be your wrist, also known as your radiocarpal joint. And this is going to allow for flexion, extension, abduction, and adduction. Then we have your multiaxial joints. These are going to be allowing the most amount of motion, allowing motion in multiple planes and all three axes of motion. Example of that would be your shoulder joint. We also refer to that as your glenohumeral joint. Now let's go over the types of movement in synovial joints. So flexion, which is going to be a motion that decreases the angle between two bones. So let's take a look at flexion here. So you can flex the elbow, we can flex the shoulder, the GH joint. So here she is flexing that shoulder, she's decreasing the angle there. Also we can look at the knee joint here. She is flexing here. You can see that is flexion there. So those are great examples there. Extension, a motion that increases the angle between two bones. So obviously these are opposites here. So we can look at extension. So here, great example. So here she's flexing her knee, and then here she's extending. She's bringing this this leg back. So she is going to increase the angle between the two bones. So the angle would be right here. You would put a angle here. Here it's getting decreased. Here we are increasing the angle right there. We also have abduction, abduction. I like to say abduction because it really, so you can really distinguish that it is abduction. When someone's abducted, you're going to take them away. So abduction, abduction is movement of a limb away from the midline. So taking it away from the midline is abduction, and adduction, adduction, you can say it that way if that helps you, movement of a limb toward the midline. So here we can see here, she has her arm, and when she raises it away from the midline, that is abduction, and adduction is when she brings it back towards midline. We also have circumduction, movement of a part in a cone-shaped radius. So if you take a look right here, if you do like, so next we have rotation, so movement of a bone about its own axis. So right up here we can rotating the head, that is rotation. That's a great example of that. Inversion, so inversion and eversion go together. So inversion would be turning the sole of the foot medially, and then eversion would be turning the sole of the foot laterally. So let's take a look at that. Right here we can go inversion and then eversion. So you can see that there. We also have plantar flexion, so downward movement of the foot, pointing the toes. So if you're walking on your tiptoes, that would be plantar flexion right here. And then opposite of that, we have dorsiflexion. So if you're going to walk on your heels, that would be dorsiflexion. Then we also have pronation, which is rotating the radius around the ulna so the palm faces posteriorly. And then we have supination, rotating the radius around the ulna so the palm faces anteriorly. I like to think of supination, if you are holding a bowl of soup, that you are in the position of supination, and then the opposite would be pronation. We also have elevation and depression. So elevation would be lifting a body part superiorly, and depression would be moving a body part inferiorly. So where's one of our examples here? So moving the scapulas up, you can elevate your scapulas, and then you can also depress your scapulas. So you can, or your shoulder. So you can think of it that way as well. Opposition is movement of the thumb immediately across the surface of the palm, and we also have that right there. Opposition, and then reposition would be putting it back. Now let's talk about the knee joint and the ligaments and the menisci. So first let's talk about the ligaments. So you have your lateral collateral ligament, which would be right here. So it's also known as the fibular collateral ligament. So first you need to orientate yourself, and you can figure this out by looking at the fibula. The fibula is lateral, so this must be the lateral side, this must be the medial side, and this is your LCL, your lateral collateral ligament, and therefore your medial collateral ligament must be this one over here, also known as the tibial collateral ligament right there. Then we need to talk about the anterior cruciate ligament and the posterior cruciate ligament. Your anterior cruciate ligament will be attaching to the tibia more anteriorly than the posterior cruciate ligament. So the name is based on the attachment to the tibia. So the ACL attaches more anteriorly on the tibia, and the PCL will be more posteriorly attaching on the tibia. We also have the patellar ligament right here, and then we have our medial meniscus right here. That's a fibrocartilage pad here, and then we have the lateral meniscus right there. So now we're going to talk about the ACL and how to test it orthopedically for an injury. So the anterior cruciate ligament rupture is a common injury suffered by athletes. So you can think about structure and function here. If you take a look at the ACL, ACL prevents the tibia from sliding past the femur anteriorly. So we are going to assess this by using a test called the anterior drawer test, or Lachman's maneuver. So what is that going to look like? So if the ACL prevents the tibia from sliding past the femur anteriorly, we want to check and see if we can force that tibia further anterior than it's supposed to be. And if that is the case, so we're pulling on it like this, if it does come anterior more than it should, then that is an indication that you may have an anterior cruciate ligament rupture. Just the opposite of that, if you push posteriorly, it's called the posterior drawer test, and you're testing that PCL instead of the ACL, because the PCL is preventing that tibia from moving posterior to the femur. So two different things going on there. More common here is the ACL injury, so the anterior drawer test, pulling it towards you anteriorly. So now let's go over some example problems. So your friend is on a basketball court when she is pushed over the leg of a fallen player and lands on the court on her bent knee. She tries to get up, but immediately realizes something is wrong. The trainer examines her knee and finds excessive motion with the posterior drawer test. What has happened? Explain the results of the posterior drawer test. So posterior drawer test, we just talked about that a little bit here. So anterior drawer test is when you pull that tibia anterior. So then posterior drawer test is when you push the tibia posterior. And there's excessive motion. So remember that the anterior drawer test was actually testing the ACL because we were pulling the tibia anteriorly, which the ACL is preventing the tibia from sliding anterior to the femur. And the PCL is preventing the tibia from sliding posterior to the femur. So the PCL is the possible rupture here. And we can look at this. So she likely injured her posterior cruciate ligament. The posterior drawer test is positive because the tibia is being allowed to move too far posteriorly on the femur. So here's another example question. So what feature is identified by number 2? So we can look right here. So that ligament is going to be a ligament here, right in front here. What would that be? So are you thinking it's the posterior cruciate ligament? Are you thinking it's the anterior cruciate ligament? Is it a LCL or an MCL, a lateral collateral ligament, or a medial collateral ligament? And of course, it's right here in the anterior, so it must be the anterior cruciate ligament. It's attaching on the anterior portion of the tibia here. So remember that the ACL and the PCL are named where they attach to the tibia. So here's another warm-up question. So what feature is identified by number 6? Where's number 6? Right there. So what is this right here? So your possible options are your medial femoral condyle, your lateral femoral condyle, your lateral meniscus, your medial meniscus. So first you have to figure out what is the orientation here, what is medial, what is lateral, and you can look right out here. This is your fibula. Your fibula is always lateral here. So this must be medial here, and therefore this would be lateral over here. So now we're going to know that our answer should probably have some medial in it. It should probably indicate medial. So then we're going to look, what is this? This is a condyle. So, and this is the femur up here. So the correct answer is the medial femoral condyle. So another example question here. So which of the following statements accurately defines an amphiarthrosis? So remember, amphiarthrosis was going to be those cartilaginous joints, and those joints that are going to allow some motion. So the correct answer would be B. So when a ballerina points her toes toward the floor, this is known as what? So if a ballerina is pointing her toes to the floor, think of her as walking on her tippy toes. So that would be, we would think between these two answers, dorsiflexion or plantar flexion, and it's actually plantar flexion is walking on your toes. So bending of the elbow occurs at a blank joint, and exhibits a blank movement. So what is the best answer here? And we're thinking for the elbow joint, we're thinking the humeral ulnar joint here. So bending of the elbow occurs at a what kind of joint? Are we thinking a pivot joint, a ball and socket, a hinge, a plane, or a gliding joint? Well, the humeral ulnar joint is going to be a hinge joint. So obviously this is going to be our answer here. And that hinge joint is going to display the movement of flexion. So which of the following statements accurately describes pronation? So we're thinking about the two differences, the difference between pronation and supination. And so first we need to get this straight. So supination, we've got that bowl of soup, we got to hold that up. So the palm is going to face up like that. So let's look at our answers here. So pronation would be just the opposite, palm facing down. So we go with A. A would be the movement of a body part toward the midline. Obviously, after reading that, we're not going to go over it. We're not going to go for that. B, movement around a central axis. Not going to go with that. Turning the palm over to face down. So ding, ding, ding. That's definitely our answer right there. So that would be C would be your answer. So which of these is not a type of synovial joint? So saddle, condyloid, hinge, syndesmosis, or plane. So which one does not fit in this category? So we have a saddle joint, that is a synovial joint. We have a condyloid, that would be a synovial joint. We have a hinge, that is a synovial joint, a type of synovial joint. And plane, that is also a type of synovial joint. So the correct answer is D. So that is the correct answer. What is a syndesmosis? A syndesmosis is a fibrous joint between two parallel articulating bones, and the example we used was a radius in the ulna. So definitely remember that example. So this will be our last question. So movement of the palm so that it is facing upward or anteriorly is termed what? So is that going to be pronation, dorsiflexion, plantar flexion, supination, or abduction? So obviously we already had pronation as one of our answers, and this is describing the exact opposite, where it's describing supination. So movement of the palm so that it is facing upward, so we can hold that bowl of soup, is supination. So supination, you can take a look here, going like that, turning that palm upward like that, that is supination.